So hello and welcome guys to my channel, the Success Association of Medical Literature. So our today's topic is for the nursing students who have to submit their clinical assignments to the college. So there are different types of assignments. We will make so many videos for the nursing students. So first video for the nursing students is the case presentation. Like the nursing students have to do a case presentation of any one of the topic given by their teachers in the clinical settings during their training as their one of their assignment. So today we will see as a case presentation which was on the lower respiratory tract infection, that is pneumonia plus pneumonia, which will lead to the respiratory failure. So lower respiratory tract infection, that means it is the cause of pneumonia, equals to respiratory failure, which can lead to a respiratory failure, or respiratory failure is a one of the different clinical diagnosis, respiratory failure, for which I have submitted and I have got 9.5 marks out of 10 marks. So the content was good, so I thought to make one video for you so you can take a reference for this and you can do your clinical assignment. So on the first page you have to give the college name in whatever college you are studying. Then you have to write the case presentation on whatever the diagnosis your patient is having. Remark and submit it to the name and the post of your teacher along with the college name and name of the student, the year the student is studying in, and the college and then the name. Submit it on the date on which you are going to submit this topic. Now let's start with what we have to write in this. So on the first page you will start with the diagnosis, whatever diagnosis. As I know, lower respiratory tract infection, pneumonia, that is respiratory failure. So this is the first page. Name of the student, your name of the evaluator, your teacher's name, subject. It was my adult health nursing, that is medical surgical nursing, which is one. Then topic, whatever the topic of presentation, the diagnosis. Class taught, your that method of teaching. I have written lecture cum discussion or clinical case presentation. Date of presentation, time, duration, venue, audiovisual aids, previous knowledge of the group. Like you have to take this is a diagnosis which will be given to you by your teacher. You have to give care to that patient for the 5 days, and after 5 days you have to write all these things and you have to do a presentation in front of your teacher and in front of your batchmates, like your students of your classmates. So this you have to do presentation. So this is the format. So then there are objectives, general objectives and specific objectives. General objectives, like after your presentation students will be able to have the knowledge about your diagnosis. Like 5 days you have for 5 days you have given the care. So after that care you are presenting this topic, so you will give the deep knowledge regarding the care, regarding the patient, whatever the diagnosis the patient was having, whatever the investigations he was having. We will see it further. So you can just go through this, what are the general objective and specific objectives of my presentation. You can change it according to your need. So firstly we will start with the health history. In nursing, like BSc nursing students or any of the nursing, GNM, ANM, first topic in your presentation must be health history. So health history starts with this format. You can go through it: name, age, gender, marital status, religion, education, occupation, address, date of admission, diagnosis, patient name, surgery, doctor in charge, name of the informant, primary health care, whatever the hospital is. So this is related to the patient's health history, which will start with first with the demographic data, chief complaints, then history of past illness, like patient does not have history of vomiting, nausea, body ache. Medical history, he doesn't like my patient was having medical history of diabetes mellitus last 10 years and she was having COVID-19. Surgical history was she doesn't have any surgical history, but she was undergone through LSA, that is cesarean section, for the delivery 22 years ago. Then previous hospitalization, allergy. Then family history, this is the family history. So you have to write the name of the family members and their details. Then family tree, you have to draw the family tree. Then this is the dietary history of your patient. This is the menstrual history of your patient. You have to ask all this to the patient. Personal hygiene of the patient. Coming to the socio-economical status of the patient. This was the health history. Now coming to the physical examination of the patient. Physical examination is one of the clinical format of Like physical examination is one of the procedure which is followed by the nursing students or by the doctors and all for physical examining your patient. So this is the format of physical examination. Physical examination starts with identification data that is related to a patient name, age, gender, bed number. All this thing you will see on the file of the patient. Then general survey of the patient, vital signs, the height, weight, BMI. Then you will go with the head to toe assessment, integumentary system, head and neck, then eyes, watch, thorax and lungs, breast and axilla. All this are the physical examination. This were the abnormal things. These things are the normal because my patient was having lower respiratory tract infection, that is respiratory failure. So it will be related to lungs. So head and neck will be normal, integumentary system will be normal, but thorax and lungs are affected. So these are the abnormal findings, like while palpation, limb, the palpation, asymmetrical chest expansion was there while the patient was breathing, then auscultation, the wheezing sounds were there, crackle sounds were there. So these are the abnormal findings. This is the abdomen. So in abdomen physical examination there are 5 methods: inspection, palpation, percussion, auscultation and olfaction is one more which is not applied in abdomen, but there are 5 methods from which 4 methods are used in abdomen. So abdomen was also normal. Then the extremities, the anorectal examination, then special consideration, that is neurological assessment, which includes sensation, cerebral function, mental status, reflex function. Then at last we'll come to 12 pairs of cranial nerves. So 12 pairs of cranial nerves were also normal for my patient. But only phrenic nerve was affected, that was a part of vagus nerve, that is 10th cranial nerve, because phrenic nerve is attached to the diaphragm and which helps in the breathing. It was affected. Now coming to the investigations of my patient, this you can find it in your patient's file. So this were the investigations done and this was the patient's value, this was the normal value. So I had columns and reference, like this was given by my teacher. There must be one more column over here. This was the investigation, patient value, normal value, and one more column which will contain remark, that what is the remark given by the doctor. This was the investigation. Investigation was continued with PT-INR test, HbA1c, that is for the diabetes, serum electrolyte, 2D echo, chest X-ray, LFT, ABG analysis, sputum specimen, then flu A, flu B, then respiratory A, B. So these were the investigations. Now coming to the drug study, whatever the drugs were given to my patient. So this is the format of writing the drug study. Drug study must be written, must not be written in a portrait format, like in the vertical format. It should be always be written in a horizontal format, that is vertical format. These are the things you have to write in any drug, like pharmacological name, trade name, class, route, dose, indication, contraindication, side effects, nursing responsibility. One more you can add over here, that is mechanism of action of that particular drug. So this was my first drug, that was pantoprazole. So this was the details. My second drug was injection AMSET, that is ondansetron, that was an antiemetic. My third drug is, which was given to the patient as my patient was with diabetes. So for diabetes, she was given with one diabetic mellitus drug, that was dopagliflozin, DOPAGLIFLOZIN. This was the format. This was the fourth drug, that is amoxicillin, that is an anti-infective, that is aminopenicillin. Fifth drug was Tamiflu, that is tablet fluir. Sixth was Nicorandil, tablet Nicorandil. There were so many drugs to my patient because she was a respiratory failure patient. So this was so many drugs, but according to your need, like if you can just mention on one paper that how many drugs are there, and from this many drugs you can explain two or four drugs depending on your teacher, depending on you and your content, you can write the drugs. This was tablet acebrophylline. See, here I have written the mechanism of action of the drug. So I have written so many. I have written 8 drugs in total. This was a fentanyl citrate injection. It is one of the most dangerous drug, that is fentanyl citrate. It is the high alert drug given only according to the doctor's prescription. We'll come to this also in my next video. So now coming to the disease condition, this is an important part in the clinical presentation. So as in that we will start with the anatomy and physiology of the lungs. So this is the lungs. Anatomy and physiology same, that there are one pair of lungs. Right lung has 3 lobes, left lung has 2 lobes. Then it is present in the mediastinum, help for the respiration. All these details you can mention. You can just go through. There are 10 bronchopulmonary segments in the each lung. O2, oxygen is taken in and CO2 is exhaled out. That. Then afterward, the introduction of the respiratory system. Then the definition of whatever the disease is there. As my patient was having pneumonia firstly. So pneumonia is an inflammation of the lung parenchyma caused by various microorganisms including bacteria, mycobacteria and viruses. So pneumonitis is a more general term that describes inflammatory process in the lung tissue that may predispose or place the patient at risk for microbial invasion. So this is the definition and some introduction. Then incidence rate, like what is the, like in India and in abroad, what are the rate of the death and the pneumonia is causing to the patient. That is the incidence rate. Then we will come to the classification. The pneumonia is divided into bacterial pneumonia, viral pneumonia, community acquired, hospital acquired, healthcare associated, ventilator associated, then lobar pneumonia, bronchopneumonia, interstitial pneumonia. My patient was affected with the lobar pneumonia. Then it was like community acquired pneumonia. Then causes, this is a book picture and this is the patient picture. Book picture means this is from the book I have written, that is Medical Surgical Nursing, which was given by the author is Lewis. So this is given in that book and this was seen in my patient. Same way, clinical manifestation, that is the sign and symptom. This wasn't given in the book picture and this is the patient picture. Pathophysiology is the stepwise process how the disease has been caused to the patient. So this is the pathophysiology and this is something acute respiratory distress syndrome which was seen in my patient. Now coming to the respiratory failure. Afterward my patient was diagnosed with respiratory failure. So respiratory failure is a serious condition that makes it difficult to breathe in your own. Respiratory failure develops with their lungs and so this is the respiratory failure. There are 4 types of respiratory failure. For this, aviates means like while presentation we have to use some aviate. So after the video, like at the end of the video, I will show you some 4 types of aviate. I have made the aviates depending on this respiratory failure. So you can just make a flashcards. I have made 4 flashcards according to the principles of presentation for showing it as one of the aviate to the students that I have presented this and I have shown the aviate. So I will show you at the end of the video. So there are types of respiratory failure. This was the diagnostic test, book picture and patient picture. Investigations, reports, CBC and other. These were the investigations. I have written so much of content. You can just do some cutouts in that content and you can do this presentation depending upon your teacher and depending upon you what you have to write. This is all in detail whichever I have written, so I thought to make one video on it. This was the management. At the end of the disease condition, management is medical management, surgical management and nursing management. Medical management done by the doctors. For this my patient, this was the drugs which were given and this were the details which were taken care of. This was the medical management. You can just go through it once. It will take more time. This was the surgical management. That is, surgical management is lobectomy. Lobectomy means removal of the partial affected lobe of the lung, or total lung replacement surgery if all lobes are affected. Like as I told in the anatomy and physiology, right lung has 3 lobes, left lung has 2 lobes. So if the lobe is affected, a single lobe, then lobectomy can be done. And if all the lobes are affected, then total lung replacement is a surgery which can be done for the patient. Coming to the nursing management, that is the assessment, diagnosis, planning and goals, and nursing intervention. So this is the assessment, assessing your patient's condition. Then diagnosis, what is the diagnosis? Nanda diagnosis, nursing diagnosis, we will come forward. Planning and goals, which will be there in the nursing diagnosis, this is the nursing intervention. Now coming to nursing diagnosis. Nursing diagnosis is Nanda diagnosis, North American Nanda diagnosis. This is Nanda diagnosis. Nanda diagnosis is North American nursing diagnosis, which is for your patient, which you will prepare. So these are the priority nursing diagnosis. So we have to mention, we can make two, I have made 12, you can mention 10, and you have to just expand 5 as you are giving 5 days care. So I will just read out 5 for you. Ineffective air clearance related to presence of excessive secretions as evidenced by inflammation and infection of the lungs in X-ray that was seen in the chest X-ray. There must be 2 that is related to and as evidenced by. The second is activity intolerance related to impaired respiratory functions as evidenced by patient refusing to talk. Third is acute pleuritic pain related to inflammatory reactions of alveoli secondary to invasion of microorganisms as evidenced by client complaining about chest pain. Insomnia, that is disturbed sleep related to environmental stimuli as evidenced by reported difficulty in staying asleep. Anxiety related to changes in health status as evidenced by distress. Imbalanced nutrition less than the body requirement as evidenced by patient decreased food intake. Deficient knowledge about the treatment related to the treatment regimen and evidenced by over cautioning and stressed behavior of the patient. These are the nursing diagnosis, priority nursing diagnosis. This is more. And out of this 12 we have to explain 5. This is the format of explaining. Same in the portrait format we have to explain. That is assessment, nursing diagnosis, goal, expected outcome, intervention, that is planning, the rationale of the planning, implementation, evaluation. Subjective data and objective data. Then the diagnosis first, as we have taken from here, the first one was ineffective airway clearance. So we have taken the first Nanda diagnosis over here. We have planned the glow. The client will be maintained a normal gas exchange with good saturation and normal ABG level. Expected outcome was short term and long term. This were the intervention, rational implementation and evaluation. So that is nursing care plan number 1. So I have planned, this is the 5, I have planned 10 interventions for each Nanda diagnosis. Let's go through it once. These are the 13 Nanda diagnosis for the first one, 13 planning for the first. This is the second one. Second was for acute pleuritic pain. These were the 5. You can just stop the video and you can just write it down, or you read it if you want it. This is the 10. This was the third one, anxiety related to change in health status as evidenced by distress. Nursing care plan 3rd, 1st, 2nd, 3rd, 4th. And coming to 5th, 6th, 7th, 8th, 9th, 10th. Then there is nursing care plan 4th, that is insomnia related to environmental mental stimuli as evidenced by reported difficulty in staying asleep. Subjective objective data, goal, expected outcome 1, 2, 3, 4, 4. And then 5, 6, 7, 8, 9. This was the 5th one, that was activity intolerance related to impaired respiratory functions as evidenced by patient refusing to walk. Subjective data, objective data 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. These were the 5 priority Nanda diagnosis which I have explained. Then coming to the nursing notes. So as you are giving the care to the patient, so you have to write for the 5 days nursing cares. So I will just give you the detail about first one, and remaining 4 you can write. I have written 5 actually. So this was the first. Name of the patient, age, sex, ward, bed number, name of the surgery if performed, date of surgery, diagnosis, doctor in charge, date on which you are giving care, medications, in injections you have to write with the red pen, and tablets you can write in blue pen, diet, whatever the diet she is following. And this was the nursing observation. This is my sign. So at 8 p.m. I have reported to the Jahangir Hospital, Pune. At 8:10 I have entered to ICU, greeted sister in charge and doctor and the patient. My patient was in the supine position and she was having intracath blue color, that was 22G with central line in the jugular vein and catheter, and she was also having Foley's catheter. And 8:30 she slept adequately with disturbed sleep pattern. She was not able to maintain his personal hygiene by her own. Activity intolerance, she was on soft diet. Bowel and bladder movements were normal. At 9 p.m. bed was untidy, unclean, bed making done. 9:10 I have checked for the vital signs. 9:30 assisted sister for IV medication. 10 BSL monitoring. 11 observed the doctor's round. History collection of patient. Assisted sister in maintaining RT feed. Assisted sister in giving position to the patient. Assisted sister in maintaining records and reports. This was the first. Then this was the second day, third days, and this was the fourth days, and this was the fifth day. At last, coming to the complication in health education. Complication, shock and respiratory failure was the further complication. Pleural effusion is one of the different diagnoses which can lead to the patient, that is accumulation of the fluid in the lungs, so which was not there, but this is the complication which can arise. Then coming to the health talk, we have to give the health talk, importance of health talk, and we have to manage on diet, medication, exercise, personal hygiene, rest and sleep, and the follow-up. This is the health talk given to the patient and the patient's relatives. Summary and evaluation at the end. Whatever the details we have studied, we have written it as a summary over here. This was the conclusion, and this was the bibliography. Bibliography from where I have taken the content, like I have taken the content from Marilyn E. Denger, Mary Frances for the nursing care plans, then Mosby Drug for the drug book, for Javed Ansari for the anatomy and physiology. Then I have referred this website. Then I have Brunner's and Siddharth's textbook of medical surgical nursing, and this was the conclusion about the patient. And same way discharge and prognosis. Prognosis is an opinion based on the medical experience of likely development of a disease or illness, later which was formed as respiratory failure. Prognosis means after the diagnosis, what is the prognosis, whether it is good, bad or fair enough. So my patient's prognosis was bad because she was having pneumonia when she was admitted in the hospital, but later the prognosis was bad because she was and lined up into respiratory failure. So this was the prognosis was bad for my patient. And at the end, this was the evaluation criteria which was given by my callers. This is the college name and your name and the teacher's name. This is the format, and this was the I got 9.5. Very well presentation, good thorough knowledge about the disease condition. Aviates were presented effectively. Need to improve the handwriting. Only my handwriting has to be improved. Now I will show you the aviates also for this. And thank you for watching my video. More upcoming videos, you can just press the like button and the bell icon, and you can just follow and share and subscribe my channel. Thank you.